Good evening, and thanks to each of you for joining us tonight for this extraordinary evening. You're going to have an incredible time. I hope you enjoyed the leading edge video. It's going to be on 200 PBS stations, reaching 60 million viewers throughout the nation. And as ASCP serves as the leading voice in laboratory medicine, we continue to unite laboratory professionals and pathologists across the world to ensure patient-centric care occurs vis-a-vis our education, our health services research, our collaboration, and most importantly, our patient-centered advocacy. In the past 10 years, we've substantially diversified our footprint. We've actually become a worldwide organization with commerce in over 90 countries. In fact, we see the world as our neighborhood. It's increasingly become a connected world, and as such, diseases are moving freely across borders and posing threats, of course, to patients across those borders, immediate threats to populations, and populations often unprepared to address them. That's where we come in. Changes in this ecosystem, in the healthcare development system, in the implementation and the actual integration of our medical laboratory tests as they evolve in perpetual motion are allowing changes to substantially be part of the ASCP revolution. The molecular and genetic basis of disease continues to revolutionize our profession. As you know, patients throughout the communities, as they inhabit these issues, expect us to help them with the challenges. And ASCP stands ready to make sure that we make the major contributions in our local communities and throughout and across the globe. As the field of diagnostic medicine substantially changes in the coming years, we're going to face a revolution how we practice medicine, and a revolution that we can either watch or we can create. And we are going to create the change. We're going to make sure that you, our members, are the critical apex of how we solve these solutions across the world. So since 1922, our strength as a global leader lies throughout the diversity of our 120,000 members. And because of you, we focus on domestic and international challenges that you value. And because of you, you help us succeed that, and you help us ensure that you're at the middle of this healthcare evolution and revolution. So what's our philosophy? Our philosophy is we embrace 4 essential values: improving patient care. We do it through advancement, through knowledge, through collaboration, and through our global neighborhood. And the latter has been accomplished by creating a team of social entrepreneurs to deliver care across the farthest corners of the earth where we need to bring available, appropriate, and timely diagnoses. And that's the laboratory diagnostic value. So from around the world to within our domestic laboratories, ASCP continues to be the best professional resource for pathologists and laboratory professionals. And we do that by expanding our influence daily through strategic alliances and business agreements. The need for organized pathology has never been greater. ASCP is focusing on the big issue that affects all of us, such as the impending workforce shortage, which we'll talk about tonight, and fervent advocacy for policies that demand improved patient care. We stand committed to promoting cutting-edge, evidence-based science vis-a-vis research and subsequent education, and that educational offerings that have multidisciplinary and clinical foci. Here are a few recent highlights. Within our global community, we focus on improving health and that of women and children. Women and children, nowhere in the world is this more evident than in sub-Saharan Africa, where you, our members, have generously donated your time and your resources to serve as consultants through the President's Emergency Plan for AIDS, or we call it PEPFAR, or through the quality of laboratory medicine and the healthcare delivery systems and other venues. Due to the enormous success of PEPFAR and our substantial accomplishments throughout 16 countries, the program is now expanded to Southeast Asia as well as Eastern Europe. And we have to look beyond the borders of the United States to help with similar disparities in those underserved regions where they need us most. So throughout consistent funding from the CDC, our efforts in patient care have expanded to make sure we build a workforce of competent practitioners, educating them on how to prepare for accreditation and making sure that they have competent diagnosticians. Now, in addition to PEPFAR, ASCP has been diligently working in areas like the Ministries of Health with Botswana, Lesotho, Swaziland to support modern histopathology, and cytopathology diagnostics. What we've witnessed is that through all of these initiatives, people are living longer with HIV due to our early diagnosis and subsequent treatment. But now the therapeutic intervention requires that we also look at the non-communicable diseases. So that's moved to the forefront of diagnostic medical care. But regardless of the country or the need or the task at hand, it's our responsibility and the need at hand to make sure that we use our tireless efforts because you support those efforts in the field. Thank you from ASCP, from the Board of Directors, for bringing glimpses of hope to patients worldwide. Now, as you're fully aware, our efforts have not gone unnoticed, and last year our keynote speaker was Hillary Rodham Clinton. She chose to commend our altruistic efforts and showcase that natural symmetry with another partner of ours, the Clinton Global Initiative. And in her presentation, Secretary Clinton addressed the needs for women's health issues and addressed the need around the globe and those closer to home, and shared our organization's efforts to expand on the pipeline of talented young individuals that need to come into our profession to support our endeavors. And as you witnessed, she's a career-long champion of equal economic rights. She's a champion for individuals across the United States and the world. But in this respect, she's also the continuum for annual keynote speakers that we've had, such as those individuals like President Bill Clinton. President Bill Clinton and others have been nationally recognized to help us to focus on these diseases. First Lady Laura Bush, Don Berwick, and Dr. Paul Farmer. All of their perspectives help transcend the politics and go past that and help us understand our role to helping patients across the world. So a common theme that reinforced by all these speakers was the critical role that we as laboratorians play in their healthcare paradigm. In fact, they underscored that crucial need to build a progressive medical laboratory workforce that continues to be leading the healthcare evolution. We are all aware that we're getting older, and the aging baby boomer population is attributing to this issue. But coupled with a significant number of medical laboratory professionals approaching retirement, we've got to ensure that we have an adequate pipeline of professionals. We have got to ensure that we're entering the workforce and bringing the individuals in the workforce that can help meet our needs. Which brings us to the organized philosophy and the mantra of ASCP. And what is that? Stronger together. Stronger together because we believe that investing time and energy and building collaborative alliances across the United States and the world helps define and improve the quality of education and helps members and residents and laboratory professionals understand the value proposition for our membership. These partnerships enhance our collective ability to influence patient care, both domestically and abroad. So in this ever-changing healthcare evolution, it's in our best interest to work together, isn't it? It's in our best interest to collaborate, to make sure that we do that in tandem with other organizations by building a global community. And nowhere else building a global community is it more evidence than our partnerships here in the United States. Now let me tell you about a few of them. The American Pathology Foundation, an organization that is part of the education paradigm of this particular meeting, and we will be co-locating with next year. The Association for Pathinformatics also have developed education sessions at this meeting. But there's others. There's the Society for Hematopathology, the American Society for Cytopathology, the Association for Clinical Scientists, the International Society for Gynecological Pathology, the Associations for Directors for Anatomic and Surgical Pathology, and many, many others. And recently, we formed an alliance with the USCAP, the United States and Canadian Academy of Pathology. And our collaboration with USCAP will expand on our reach in education and myriad other opportunities in pathology that together we can collectively broaden our global impact. That's right, the time has come. So our increased relevance to medicine mandates that we be part of an evidence-based solution. Therefore, within the past 5 years, we've launched significant focus on an area that's quite atypical in association world, and that is health services research. We want to ensure that pathologists and lab scientists are the drivers behind establishing evidence-based healthcare solutions, and doing that through patient-centered care. But how? Well, by working with our clinician partners and by looking at educational offerings that we can drive healthcare delivery improvements. So ASCP invests very deeply in elevating the quality of the knowledge of our members by providing health services research. And this includes cutting-edge content and new and emerging opportunities for our members throughout the nation and with their peers, so they have the opportunity and the experience to share with their clinical colleagues. We will write, we will execute, and we will deliver upon scientific cutting-edge education, so we will bring new approaches to diagnosis and treatment for patients worldwide. It's the multidisciplinary clinical team, and that's patient-centered advocacy. And we also believe in collaborating with our industry partners, such as the industry partners that help support the Career Ambassadors Program, Roche, Genentech, Celgene, as well as many other important partners, and as well as our partners with accreditation, the American Proficiency Institute. So the goal is to continue to be the premier provider for education worldwide, but to make sure we do this in tandem with our organized pathology voice. Over the past several years, we've moved from receiving a few external grants to millions of dollars a year in grant funding, millions each year to support the development of education delivery products so clinicians and pathologists and lab professionals can work together. Most of this centers around the importance of members of the medical team and understanding each other's values and each other's roles. And, quite honestly, improve communication between our profession and other professions. We know that going forward, if we're going to improve the value proposition for the laboratory, we have to engage the clinical team. And the laboratory has to step out front to lead that team. That's right, step out front. So a few examples of these grants include novel work on the management of non-small cell lung cancer, peripheral T-cell lymphoma, myelodysplastic dysplasia, stage 4 breast cancer, and many others. But we're continuing to pioneer state-of-the-art approaches using this education paradigm to position you, our members, as the consultants on these best practices for diagnostics and treatments. And ultimately, it's going to guarantee that the right information at the right time will empower the patient to get better diagnostics and understand their disease state and his or her needs.